Well, it's a great pleasure to be here. And Mrs. Perdue invited me, and I took this opportunity because I want people to know about us. I'm the president of the Institute of Medicine, we call IOM, and it's an organization that has great reputation of advising the nation how to improve health. We actually are the health arm of the National Academy of Sciences, which was founded in 1863 by Congress and Abraham Lincoln as an independent organization with the very best minds of the nation to advance on science, advise on science. And because over the years we've developed the medical arm of the organization called IOM. In what we do, a lot of our work, 50% or so, is directly from Congress or from the executive branch, from agencies. They would have tough questions related to vaccine, related to the VA, and they'll ask us to help them. Related to the Affordable Care Act, what do we do about women's preventive services? And we'll do a very extensive review and give them the best people, and at the end give them the recommendation, which they usually will adopt and becomes policy, right? The other 50% of work, I believe, so important because we're advising the nation. So it should not only be government work, it should be what the people want. And that's why I'm here. You know, we want to hear from people, what are the things that really concerns you? What are the things that we need to advise the government to do? What are the things that we can help you make decisions? So I took this opportunity right away to say, this is where I need to be. I want to make sure I get to meet people out here and have a chance to talk to them. I was born in China and post-war, so I've seen a lot of the issues of poverty, health disparities, and so I've been very lucky. I came to this country at age 18 to study, and this country's treating me really well. And so I think this job is my opportunity to serve the nation. We've been to Boston, New York, Palo Alto, San Francisco, Chicago, Houston, Dallas. And I think people have all the same issues, which is what's in the future, right? What do we need to do to be sure that everybody have access to good quality health care that we can afford? And perhaps even more important is how do we maintain a healthy society, right? Not beyond health care. You know, how do we stay healthy? And, you know, and what are the kind of things that we can address, to address the many issues that we have in our society, because they all affect health, right? Education, schooling, jobs. And my feeling is that we need to address all of these things and not just health and healthcare. Frequently, the subject that comes up is, in particular, the issue of prevention and community health, right? Because I think that we build really good hospitals and even clinics, but I think we're not reaching sufficiently to the people who live everywhere, and they need access, they need ways in which they can promote their health, and they need sort of focus on how to help them in getting to a healthier state. You know, the nation is defined by both in your backyard and everywhere else. In fact, we define the globe. You know, U.S. is also in the globe, so I think our work extends well beyond U.S. as well. In fact, recently we're working on a big project and seeing from the Ebola lessons learned, how can we prevent that in the future? And preparedness in response to pandemic, what's the kind of emergency response do you need? So that's the kind of work that we do. And thank you for the attention I'm getting. But more importantly, I really want to be able to meet. And Missy, you've arranged for me to meet with a lot of people, to have a really good conversation. And you know, my team is here for the same reason. They want to take notes, so you go back and help us think about, you know, what we need to do next. And one example of, I think, a very important report that we did, that the government would not ask us to do, which is the end-of-life care, right? The death panel issue, nobody would touch it. We released a report in the summer about what people need to think about when you are, you know, towards the end of your life. How do you prepare yourself? How do you think about cultural sensitive issues? How to use hospice care? All those things are really important, and yet people don't dare to talk about it. So we do things like that. I think the strength of our organization is because we're not part of a government. But it was founded by government, so the government founded in order to have people they can rely on for advice. And these days, because trust is a big issue, right? When you have the very best minds, and we literally have the very best minds, not only in this country, but we can call on anybody, anywhere, to come and say, we've got this really tough issue, what kind of decisions should we make? What kind of recommendations you make to the government? You know, then people say, those are trustworthy recommendations. And I think that's a strength of our organization. In fact, I live in Washington, it's in my backyard, right? I mean, what better than to talk to people who live around the area that we serve.